Can hip impingement or FAI be increased with coughing and sneezing? Now, a lot of you may have experienced that type of phenomena. I'm here to tell you a little bit more about it and maybe what you can do about it too. Hey everyone, I'm Sebastian at Performance Place Sports Care, part of locally world famous chiropractors in Costa Mesa, California. Now, this is just part of a series I'm doing on hip impingement or FAI, trying to debunk some of the mystery surrounding it and hope to give you guys a little bit more education about exactly what to do about it. The short answer about if hip impingement can increase with coughing or sneezing is essentially no. The answer is that it can't. But there's other things that can. The reason why it can't comes down to the simple anatomy around the area, and I'm going to use these two models to give you a better idea of what I'm talking about. Now I'm going to slide up a little bit here with this guy first so you can get an idea of the general location we're talking about. Okay? And so I don't have a full spine model that'll get this low that has the rib cage and stuff like that, but just imagine the rib cage right around this area. Now, when people cough and sneeze, they increase what we call intra-abdominal pressure, meaning pressure with inside the abdominal cavity here, okay? This red area is the lumbar spine, the low back. This is the thoracic spine, the, I think, orange area, and the rib cage attached to that. Now, hip impingement, or FAI, femoral acetabular impingement, comes down to this section right into here. And so it's essentially not part of the intra-abdominal cavity. There are other things that are part of that cavity, such as disc, lumbar disc, which can be affected by coughing and sneezing. Even these little guys here, the nerve roots can be affected by it, as well as some other sinister pathology that can be affected by it as well. So it's always important to be checked out to figure out what you have. And that's why I love that you guys go through YouTube videos to learn a little bit more. But essentially, if you want to get down the brass tacks of what it is and what it's not, you need to be examined thoroughly by somebody who knows what they're doing and can perform a thorough physical exam to figure out and stress test the areas that we're talking about. Now, this is the actual hip model. It's not the best representation of hip impingement, but it'll give you the basic idea. So I'm going to slide up here again just so you can tell what's going on with this guy. Now, this guy is, this is going to be kind of the outer part of the hip, if you will. Here's the right side of me. Here's like where my pubic bone is, and here's the front of my hip. Here's the hip flexor muscle right there, and so on. Now, hip impingement is not necessarily associated with the hip flexor. It's not associated directly to the musculature in the back, like the gluteal muscles or the rotator muscles, but it's more about the actual architecture of the area in front here, called the hip capsule, or the interplay of the pelvis on the femur. And I'll explain a little bit more here. Now I'm going to hold the femur in place as if you're standing in one place, and we're going to rock our pelvis forward. Okay? You can see that this moves, such as you're bending forward, but also this can happen too, where you're just bending your knee towards your chest. Both of these are approximations of the femur towards the pelvic rim. The pelvic rim and the femur are said to have some impingement associated with femoral acetabular impingement. Sometimes there's bony things that can create it. Sometimes there's mechanical, biomechanical loading processes that can create it too. By no means are these all surgical cases. I think you should know that first off here. Now, as we go through this video series, I want you to learn a little bit more about different things that you can do. We're going to cover stretches, exercises, things that it is, things that it's not, treatments that may or may not work, and just give you the ideas so you can figure out what to do on your own. If you ever want help from us, we do see people virtually or in person, so you can always reach out to us as well. And we also have a webinar that's going to pop up in the corner here too. Now, some of you may have pain rolling in bed, turning sides in bed with hip impingement. I'm going to show you a way that we can do that in the next video. And by also, just so you guys do know that you don't need to live with this forever. I know someone may have told you that you need to live with this forever and this is just the way it's going to be. It's usually not. Most of the time this is super rehabable, usually requires some type of exercise, stretching, and habit changes to actually get you out of the weeds, and most people get back into full activity. So click on the next video, and I'll see you there.